So I've been with the American Heart Association since about 1995. Some of my key memories as the first president of the New Orleans chapter of the American Heart Association revolved around laying the groundwork for smoke-free NOLA. We had to look into getting others who were interested in the same project, other stakeholders that were maybe not conventional, like the employees who worked in the casinos or the musicians who worked in their venues who were constantly exposed to smoke and the deleterious effects. We went on to have a coalition that was able to work with the mayor here, and of course with the American Heart Association and the science and education from the American Heart Association to stress the importance of a stress and smoke-free environment.
We started in about 2007 and to work with smoke-free NOLA and work through the end to completion and see it actually come about in 2015 was exciting. To be able to walk into a bar, a restaurant, and no smoking, because you have to remember as an ICU nurse and been an ICU nurse for a number of years, I actually came up where we were smoking in the hospitals. So to see this smoke-free NOLA actually take place was one of the most rewarding things.
That was one of our biggest accomplishments during my tenure.
I initially started off volunteering in the 1990s with American Heart, and it was I think it was in the early 20s that Jessica Gramillion asked me to help start the Circle of Red. And as an ICU nurse, I was excited. And I was told that the Circle of Red was supposed to be a group of women that were influential women in the community that could give insight to American Heart and to the organization. We set out and we invited several friends, and with the several friends that we invited, they invited several friends, and then we actually became and chartered the Circle of Red in New Orleans. One of the great things was getting to meet different people that had like interests. And one was a ballerina that we met that had a stroke. And she became one of our charter members. And she was so excited about educating people about heart disease and working with us in the school system. To see her, because she still had residual from her stroke, to see her energy and her joy. And she was willing to share the successes of her recovery. And so that for me was just another motivator to hear her story and to hear how excited she was to even share.
My background is in public health and epidemiology, and understanding the barriers to access are not just simply financial or transportation. It's so much bigger than that. It's deeper than that. And seeing how the AHA has really honed in on what this community needs and been able to meet them where they are and provide from nutrition access to advocacy at the state and local government levels, that's been a really rewarding experience to observe and be part of.
Federal Lobby Day, I went twice, and it also showed you some of the power you have as a citizen, as a survivor, to speak up. It gave me a chance to speak up, not only for myself, but for the other people in my state, and let them know how important that is for the state of Louisiana. And I have to say that felt pretty good afterwards, because I really felt like that had made a difference. I am a second-generation volunteer and proud of it.
One of the things that I think we were most proud of is making a change in CPR in the schools and making it a requirement for graduation for high school students in Louisiana, technically called the Burke-Cobb Act. And what actually happened was this young man practicing football and then afterwards just enjoying a game of basketball in the gymnasium there. And while playing basketball, unfortunately, he collapsed. And no one was able to do CPR until the emergency medical services arrived. Because his parents realized that even in their sorrow and pain at losing their child, they partnered with their local state representative and with the American Heart Association to promote that event as an opportunity and an educational experience to the other parents so that any child that collapses can receive CPR until expert emergency medical services is available.
You never want to see an athlete on the sidelines not getting that immediate response to care because we haven't made it a priority to take care of our kids.
My real hope in my career is that one day I'm not needed. I hope that we are able to fight cardiovascular disease and cerebrovascular disease and be able to make it that women and men of any age, of any race, of any creed are healthy and they don't need me. I'm hoping that the American Heart Association, my role here, I hope that I'm able to impact our community in New Orleans and help us have a healthier, brighter future.
After my diagnosis with coronary artery disease, I then left that doctor's appointment and I knew it was going to be a success story. And so as soon as I got home, I started Googling only because my cardiologist said, Essence, now you have heart disease. Someone from the American Heart Association called me and asked me to be a part of this wonderful organization and start spreading the word in New Orleans around heart health, heart disease prevention, and it's been life-changing ever since. And I get the opportunity to go back into my community where I'm from in the Lower Ninth Ward and give back to those girls, and it is so rewarding and such an incredible opportunity.
When I put my red on, not only do I feel like a warrior and I go red for all of our women in the community, but it's really just to tell us that yes, we are amazing and strong, but we are also vulnerable and susceptible to heart disease, and stroke health is incredibly important.
We will move into our second century with bold hearts focused on the work ahead while honoring our life-saving history with those who have made it possible, our volunteers, donors, advocates, and staff.
I go red for a healthier future.
I go red for survivors because I want all of them to know that you can live with heart disease and you can live out loud.
I go red for women, specifically minority.
I go red for scientific discovery to improve the lives of all women.
I go red to advance health and hope for everyone, everywhere.